Soft tissue palpation of the hip and pelvis. We're going to begin by palpating the borders of the femoral triangle. So could I have you bring your foot up to here for me, please? And could I have you take your hands and make this shape and place it right over your groin, please? We're going to begin by palpating the inguinal ligament just below her hand. I'm then going to palpate down the medial side of the thigh and palpate the adductor longus muscle. I'm going to come back up to the anterior superior iliac spine and palpate the sartorius muscle to just below the knee. Okay, you can relax your leg for me. We're now going to palpate the quadriceps muscle, and we're going to do so first as a whole. We're now going to isolate each muscle, beginning with the vastus medialis, beginning proximal to distal. I'm then going to palpate the rectus femoris. I'm then going to palpate the vastus lateralis from proximal to distal. I'm then going to take a tissue pull, medial to lateral, attempting to demonstrate that I'm exposing the vastus intermedius. I'm then going to palpate from proximal to distal. Okay, now what we're going to do is we're going to palpate the greater trochanteric bursa. That's just on the side of the thigh. I'm going to demonstrate on this leg. So right over the greater trochanter. We're now going to have our patient roll over to her stomach. So we're going to begin by palpating the gluteus maximus. We're going to palpate the entire muscle, and we're going to S-shape our way through. We're then going to palpate the gluteus medius. So can I roll your shirt up just a little bit?
Mm-hmm.
Can I roll the pants down just a touch?
Mm-hmm.
I'm going to palpate for the PSIS. And from the PSIS, just below the iliac crest, moving over close, all the way over to the greater trochanter, is the gluteus medius. We're now going to palpate the sciatic nerve. We're going to first touch the bone our patient sits on with our knuckles here. So I'm going to touch the bone you sit on. Is that okay?
Yeah.
I'm going to first find the ischial tuberosity, then switch to where my fingers can palpate the ischial tube. I'm then going to locate the greater trochanter, and I'm going to find where these 2 points intersect in the middle. I'm then going to palpate the sciatic nerve. I'm next going to palpate our cluneal nerves, and there's 3 different lines that we're going to palpate: above the iliac crest, at the iliac crest, and then just below, which will be over close. So the superior portion over the actual iliac crest itself, and then just below the iliac crest. I'm now going to palpate the hamstring muscles. We're going to palpate collectively. I'm going to be touching the bone you sit on. Is that okay?
Mm-hmm.
So I'm first going to locate with my knuckles and then point to where they start. And then I'm going to palpate the hamstring muscles as a group. I'm now going to palpate each individually, beginning with the bicep femoris from ischial tuberosity all the way down to the lateral aspect of the thigh. I'm then going to palpate the semimembranosus from ischial tube to the middle or medial portion of the thigh. I'm then going to palpate the semitendinosus